Janet, how are you?
In a Queensland First trial, this mental health nurse rides with police to some of the night's most critical incidents.
We had one fellow that was walking the street with an axe and he was delusional and he was hearing voices.
From people threatening suicide to hearing voices and drug-induced psychosis, the nurses help calm the situation and find out the cause of distress.
People appreciate the fact that they're not going to be dragged off to hospital, that it's not a police response, that it becomes an appropriately medical response.
The next day they follow up, making sure the patient is getting the help they need.
They are more likely, we find, to link with the services that we advise them to because you build a level of trust.
In Ipswich, 50% of mental health call-outs are for threats of self-harm. Increasingly, it's kids needing help.
We've been a bit surprised. The trial has shown that 36% of our calls for service relate to juveniles.
12 months on, it's got the tick of approval from the Health Minister, with 90% of mental health call-outs being diverted away from the emergency department.
Sure, there is an expense involved in these two staff members, but that's an expense that would have been incurred probably more than if that patient had have been brought here to the emergency department.
The same goes for police.
Around about 12 minutes, they're being released back to their normal job, so that's a big plus for us.
Janet and her colleague work 5 days a week from 3 p.m. to 1 a.m. and every second weekend. But for her, it's all worth it.
Without a doubt, this program saves lives.
The success of the program would now see it rolled out in other parts of the state. Lucy Murray, ABC News, Ipswich.